Hello. Good morning, everyone. Acute onset esotropia is characterized by sudden onset diplopia, which often causes discomfort and profound visual disturbances for our patients. Classically, three types have been explained: the Swan type, the Francisi type, and the Belshowski type. But with the recent onset of COVID-19 pandemic, there has been a rapid increase in the incidence due to excessive near work among children and young adults. Even though we have a variety of surgical modalities, treatment modalities available, surgery always remains a mainstay, but the eating prism phenomenon makes it difficult to titrate the accurate surgical values. In such scenarios, Botox has revolutionized the treatment with satisfactory outcome within a short span of time. So we decided to study the effect of botulinum toxin A in the treatment of acute onset esotropia in our population. Ours was a retrospective interventional study where we included patients less than 30 years of age with an angle of deviation more than 16 prism diopters. All patients underwent neuroimaging to rule out an intracranial space occupying lesion, and after a preoperative orthoptic assessment, we have injected botulinum toxin into the belly of medial rectus muscle using a 27-gauge needle under local anesthesia or general anesthesia, and the doses were titrated based on the angle of deviation as per the institutional protocols. Treatment success was defined as orthotropia, or an angle of deviation within 10 prism diopters, and recurrence was defined as a new onset diplopia or esotropia after 6 months of successful treatment. A total of 27 subjects were enrolled in the study who received Botox with a mean age of presentation around 13 years, with 67% complaining of squinting as a major symptom and more than 95% giving a positive history of excessive use of smartphones. The duration between the onset of symptoms and Botox therapy ranged between 2 weeks to 28 weeks. We got a statistically significant drop in the angle of deviation from nearly 41 prism diopters preoperatively to approximately 15 prism diopters at their final follow-up, which is at an average of 10 weeks. And this is the clinical picture of our youngest and the oldest subjects who had excellent outcomes at their final follow-up with Botox therapy. Apart from ocular alignment, stereopsis and sensory fusion was also found to significantly improve with Botox therapy within a short span of time. And comparing the effect of Botox therapy on outcome measures, we found that patients who took Botox within 3 months of onset of symptoms had a statistically significant outcome in terms of ocular alignment and BSV, as well as stereopsis, even though it was not statistically significant. And a total of 11 patients eventually required surgery for attaining optimal ocular alignment, which included 3 cases of recurrences and 4 patients who remained status quo in view of their large angle of deviation at the time of presentation. And none of our patients developed complications to Botox therapy. The etiology of acute onset esotropia always remains a subject of debate, and sustained near-point demand could contribute to an imbalance between accommodation and vergence mechanisms, which we believe could have potentially triggered the dynamic activation of medial recti muscles, especially in our subjects where none of them had an uncorrected refractive error. The primary aim is to alleviate troublesome diplopia, and we attained a success rate exceeding 50% with Botox, enhancing the quality of life of our patients much more rapidly than a surgical intervention. And we believe that the recurrence could be linked to residual implicit deviation and persistent excessive use of mobile phones post-Botox therapy, highlighting the importance of patient factors and adherence to post-treatment instructions for the success of Botox therapy. And better results could be obtained if Botox is taken within 3 months, because prolonged misalignment can change the contractile properties of the muscles and reduction in their neuroplasticity, hence affecting the outcome. And our comparison with other studies in literature shows the fact that Botox is definitely a globally recognized treatment option, but not all cases may achieve full alignment within the specified criteria and in the short period of time. To conclude, I would like to say that Botox is definitely a preferred choice for early postoperative visual rehabilitation in acute onset esotropia, especially when it is administered as early as possible within 3 months of onset of symptoms as per our study. But the appropriateness of this study should be assessed individually for each patient. These are my references. Thank you. We have no financial disclosures.
Thank you, Dr. Praveena.
Thank you,
I
ma'am.
think acute cases present with diplopia.
Yes.
So that becomes an important indication.
Yes,
In
ma'am.
pediatric cases, how did you titrate the dose? Was it the same as you give in adults? Because you have shown me the dosage table based on the amount of deviation.
Yes, ma'am.
But
Usually
pediatric patient, the youngest one you showed was a 4-year-old.
4-year-old, ma'am.
Yeah.
There we have given as per the Allen Scott protocol only, where he has given around 2.5 or less than 2.5 units.
Right.
Yes.
So based on age also you have done
Yes,
the
ma'am.
dosage.
Yes, ma'am.
Right. So and what about the recurrences? What was the longest follow-up you had?
Longest follow-up was still 6 months.
6 months.
6
So
months,
up till
yeah.
6 months you had very few recurrences, you are saying.
No, we had 3 cases of recurrence. Actually, those recurrences happened after 1 year.
Okay.
Some patients came even after 1 year. Most of the
Right.
follow-ups were within 6 months. But after 1 year, like patients were very satisfied. After 1 year, they came to us telling that, okay, they had more mobile usage and they were having recurrences.
Right. So did you introduce those environmental modifications as well?
Yes, yes. Initially, we had a total of 55 patients who came up, but only 27 were fitting into the criteria for
Okay,
Botox.
got it.
Others were given divergence exercises, prism therapies, and treated.
All right. Thank you.